Hey, it's Marissa. I'm here in Appleton today with Dr. Brittany of Innovate Chiropractic and Rehab, and we're here to talk about her business because she opened her own practice and I'm super excited about it. We actually know each other from high school. We were cheerleaders together. So Brittany, why don't you tell us a little bit about why you wanted to be a chiropractor? You said it kind of stemmed from being a cheerleader.
Yeah, so when I was 14, I was stunting. We know how stunting goes. And what had happened is I ended up fracturing my low back. And with that, I saw tons of doctors. I was in and out of appointments. And finally, my mom had made me a chiropractic appointment because I'm like, I'm not having surgery. I'm 14. So when I started seeing a chiropractor, I was under care for 3 months. That involved adjusting, rehabilitation of the muscles, the spine, everything. And by the end of it, I was able to compete at regionals and state that year. So that kind of inspired me to become a chiropractor just because it changed my life and I avoided surgery and drugs. So
yeah, absolutely. And you told me earlier you like to run your practice in a way that people heal and they don't need to come back for the rest of their life. So your goal is to heal them completely. And can you tell us a little bit more about what makes you different?
So the goal is that somebody doesn't have to continue to come to a chiropractor or a provider, physical therapist, anything like that. So stepping away from the traditional chiropractic model where you get in, get adjusted, and you leave. That usually results in you have to follow up in a week, you have to follow up in 2 days, all of that. It's not finding the root cause of the problem. We can be adjusting the problem, but it's not fixing it. So what we do then is our appointments run up to 30 minutes long, up to an hour, where it's one-on-one training with me personally. And what we are doing is we are doing soft tissue work, we're doing stretching, we are doing dry needling, anything that fits with that person specifically. But then we are also specifically targeting the area that is the issue with rehabilitative exercises. So we are working one-on-one, I'm working alongside with them, correcting things as we go. If I see them compensating some way or another way, we are fixing that. And typically our treatment plans run between 12 weeks, 6 to 12 weeks. You're doing better, we release you from care, but we don't stop when you're out of pain. We finish out the results.
Yeah, and I noticed one of my big misconceptions that we talked about is, do you feel the need to go to a chiropractor? Like, does there always have to be a need, like you're in pain, or is it something that's just good to go do regularly?
It is a good thing to do on kind of a basis. I would say every 3 months. It's like going to the dentist. Sometimes you can go every 6 months. Just getting checked out, see if you're moving physically right. Is your range of motion good? A lot of people sit all day long for their job. So sitting all day long can be a whole nother can of worms where it can affect the hips, it can affect the low back. Even if you're not feeling pain. I mean, we kind of try to avoid pain in our office in general. So no, you don't need to have technically a reason. We do offer wellness. There's nutrition aspects to it. It's overall, how do you want to improve your active lifestyle?
Awesome. Well, if people want to learn more, where can they find you?
You can follow us on Facebook or Instagram. Those are the two big ones. Otherwise, we are on Google and you can search us on Google.
Awesome. Well, thank you so much. This was great speaking with you and seeing you again. And I hope you all check out Brittany's business.
Thank you.